Hello, everyone. This is Dan Hoost, Sullivan County Government's Communications Director, here for another chat with our Public Health Director, Nancy McGraw. So we're going to get right to it here and talk about what is going on with these COVID vaccines that are now being distributed. Nancy, first off, thanks for being here today. I know it has been already, and this is being recorded on a Monday, it's already been a crazy day and a crazy week. So the first question is, has Sullivan County received any supply of vaccines, and if so, when and how will they be distributed? And if not, will the county receive a supply?
So we have pre-booked our vaccine, and we've been very busy planning for our first clinic, and that will be a closed clinic, and pre-registration will be required. So once we're ready to provide more information in terms of which priority groups are eligible, and that we're ready to start registering, we will get that information out.
Okay. So there's been a new announcement, a next, I guess they're calling it a phase. There was a phase 1A and now there's a phase B that has been announced to get the vaccines. Is there going to be a phase 1C or does it go to a phase 2? How does this work?
There are phases that were identified in the state's statewide vaccination plan, as well as that it's connected to federal guidance in terms of priority groups that must be followed. In terms of how quickly those priority groups are opened up, in terms of making people eligible, really depends on the availability of vaccine, and that is controlled by the state. We're waiting for more information on when and how much vaccine will become available to counties. So not only are we waiting for that information, but our hospital is waiting for that information, as well as the other healthcare providers in our county that registered to be providers of vaccination clinics. So we are busy every day behind the scenes, planning, making phone calls, talking about how countywide we can best coordinate everybody who's needing to do vaccinations, wanting to help, offers of assistance, and really making sure that the public has the information available on how to register. So we ask people to be patient because right now that information is still forthcoming in terms of how soon people can begin to receive vaccine who are in those priority groups 1A and 1B.
And those priority groups they look like, from what I've seen, and you can go see them for yourself on the state website, those priority groups look to be focused on frontline healthcare workers, first responders, teachers. Do you have any idea what the next phase will include?
So priority group 1A is frontline healthcare workers in hospitals. And that's been ongoing since December 23rd. Garnet Health it has been very busy doing vaccination clinics almost every day during the week for the last several weeks. They're getting through about 150 individuals per day. Now those are registration links that we're assisting them in coordinating to reach out to individuals and groups that we know we have contact information for through our emergency planning lists and information. So we're helping them to put together lists and contact information, and then a single point of contact will be sent a registration link either for their agency to register their staff because they qualify, or to certain healthcare provider related groups. So that's been 1A. 1B is next. That includes essential workers, people over 75, and a whole very, very long list of first responders, police, EMS, and whatnot. And so once, we have to make sure that people do not unnecessarily have to wait in line. We don't want people waiting in line, certainly because COVID is still on the rise. We want to make it efficient, both for public health and for the hospital. So we're making sure that the registration links are sent to people who are currently eligible. We ask everybody else to be patient and allow time for more vaccine to come in. We will be updating our information on our website and our information line on a daily basis, probably, for the next several weeks.
How do people get notified, for example, if they are, and currently in Phase 1B, for example, a in-person college instructor or a volunteer firefighter? How would they get notified?
So again, we'll put out information on our information line as well as on our website. We're also going to link to the other providers in the county that are conducting registrations with these priority groups and assist in that way. At some point, and this may not be for a month or more, it really depends on how much, if we get 100,000 doses of vaccine in the next 3 weeks, which I doubt, we would probably get ready to stand up a drive-through clinic. We are talking about that and working on that, and that would be open to the public. We would also try to pre-register people for that. So there's an awful lot of planning going on. We just ask that people be patient, and in the meantime, continue to follow the protocols about mask wearing, social distancing, and hand washing, because our cases continue to be on the increase. So even after vaccination, people are going to need to continue to wear masks until we have a significant percentage of the population vaccinated, and not only once, but getting that second shot before we start to see herd immunity for the county and for the rest of the state.
I've heard a few people ask this too, a concern that they get the first shot and then there's not a second shot available for them. But
Well, the state is planning very carefully around that because we want to make sure that the planning is already in place for people to come back to the same location for their second shot. So that vaccine does need to be, we can't hold on to it, but we have pre-booked in advance for it. And everyone is following that statewide plan. Now, if things change at the federal level after January 20th, in terms of whatever federal strategic plan gets put into place, things could change again. So we'll have to roll with the punches and see what happens.
well, that is what public health does on a regular basis. So, speaking of these vaccines, do you believe they're safe? I mean, they were rolled out very rapidly.
Yes. There's a lot of misinformation being disseminated out there, especially on social media. So, while it is true that this is a new vaccine and we won't know the long-term side effects, if you will, in terms of research for years, whenever there's a new vaccine, whether it's polio or HPV vaccine or something else, the same is true. Because this is a new vaccine in terms of emergency use authorization, there are those concerns. However, getting vaccinated will give you much more protection than not being vaccinated and being exposed to COVID-19, because you can get very sick from it and die from it, or you can pass the virus along to a very vulnerable family member or friend or co-worker, and the consequences, could be significant, much more so.
Mm-hmm.
So we focus on vaccination as a proven scientific public health measure that's been around for hundreds of years, and vaccines work, they save lives. We would encourage people to go to our website and to other credible resources like the Centers for Disease Control, the Academy on Immunization Practices website. We have all these links on our website at Public Health too, where you can do more research. And we have developed a one-page information sheet on commonly asked questions and answers. That's pretty quick to read and easy to share with your family members, friends, coworkers. It's in English and Spanish, and that is also available on our website. And it's common questions that you hear, like, they rolled this out so fast, why, can we trust it? I think the fact that you see tens of thousands of physicians and nurses and healthcare providers and public health workers, first responders, lining up to get this vaccine, that they've reviewed the scientific literature. They've done the standard required clinical trials with tens of thousands of people prior to releasing the vaccine to our healthcare providers and the public. So with very, very, very rare adverse events. So I believe that at this point we can say it's safe.
Have you identified what population, or it'll be up to the state at that point, who you're giving the vaccine to?
So it will depend on the amount of vaccine that we get, and we may not know that until the week of our clinic.
Because you don't have the vaccine yet.
Correct.
Okay.
Correct. And so it'll depend on the amount of vaccine we receive. We'll put out a registration link and we'll make an announcement regarding registration. For those who don't have internet access, we will have a phone number for people to call for help in getting registered. And it will be on a first come, first served basis for registration based on who's included in that priority group. So it's pretty big right now in terms of the priority 1A and now 1B.
But it still won't be for the general public. We have to follow the state rules on eligibility.
Correct.
Right.
Yeah. Yeah, I don't think we'll be having open pods open to the general public, first come, first serve. You don't have to register for quite some time.
Mm-hmm.
And that is true for the other organizations that are currently doing this.
Any idea as to when they'll be available to the general public?
Can't say right now.
No.
Yeah, if I told you something today,
Yeah.
it would change tomorrow.
Right. Is there a cost to pay
No, this is free.
for anybody and everyone, whether you have insurance or not?
And everywhere, yes. If you go to Garnet Health, if you go to another location that's providing it, there's no charge.
Swinging slightly away from vaccine and just an update generally on coronavirus, you mentioned the dashboard. People have continued to ask this. I know you've mentioned this before, but I want to bring it up one more time. The state's dashboard has numbers that are different from the county's dashboard, virtually all the time, I think. Why is that?
Well, that's because we are preparing our numbers based in real time, boots on the ground, what we do every day. We get the lab reports every day. So those numbers get sorted out, both on our end and on the state's end, in terms of county residents. You know, we get lab reports sometimes where somebody may work in Sullivan County, but they live in another county, like Orange or Delaware or, Ulster. So we have to transfer that case to the appropriate county. Those numbers come off of our reports. We really haven't been given a lot of detail about how the state compiles their dashboard numbers, although we've requested it, but it's statewide. So no matter where in the state somebody goes for a test, those lab results, get uploaded. It's a statewide electronic laboratory reporting system. So I'm assuming that, at some point in the data collection, all the county level data gets sorted out. But it's always been at the local level and the local health department that, we trust that our numbers are the most accurate.
Mm-hmm. And finally, we actually had somebody ask this the other day. Are you still doing public health advisories? Because they haven't seen any recently. Of course, that should be good news, but they're seeing the numbers increase as well, the number of active cases. So is it just there's been better compliance at some of our local businesses, or better contact tracing?
Well, I would say, now that you've said that, there's probably going to be another health advisory very soon. But what our staff are seeing currently is that most of the new cases are isolated in terms of household spread, people having friends over, having parties at their homes, their private residences, not necessarily business related. There are a few here and there that are business related, but we don't do, and this is a reminder from something we've shared before, we don't do a public advisory necessarily on every situation where there was an employee of a business. If they've got plastic barriers up, which most of these folks do in their places of business, if they were wearing a mask, if they can identify within a certain time period that they only exposed, 1 or 2 coworkers, and that the protocols in place were there to minimize the exposure to the public, then we wouldn't need to make a public announcement. So it really depends on the circumstances of each individual situation.
All right. Is there anything else you'd like to mention that we haven't discussed?
Just please refer to our website. We're going to keep updating the information. We're also updating our public health information line for vaccine-related questions that you can listen to. You won't be able to leave a message because currently we just don't have the manpower or woman power to answer all those questions and have somebody call you back individually every single day. So we would ask that you be patient. We're going to be providing updates as we move through this, and we're working very closely with Garnet Health, with Sun River, Center for Discovery we've been in conversations with, as well as Refuah, which is another federally qualified health center in our county. So if pharmacies become available in terms of vaccinating the public, we will put that information out as well. We're coordinating the gathering of that information. The pharmacies, along with all healthcare providers, earlier in the year were asked to become eligible providers of vaccine and to enroll and sign up. So that process already came and went, and we're just waiting for more information on who signed up, who's eligible, who's ordered vaccine, and who will be conducting vaccinations in terms of pharmacies. I know that the outpatient healthcare providers such as Crystal Run Healthcare, Garnet Health Outpatient, and Urgent Cares will be doing it. It's just a matter of time in terms of when they can get their vaccine, how quickly, and how soon can they scale up doing both their employees and their patients.
And even when that happens, people should be reminded it's still going to take registration and an appointment, even if it's with them, not through us necessarily. For example, Garnet has been handling their own registration. It doesn't come through us, but it's still a registration. You cannot just show up and get the vaccine.
Yeah, we would really discourage people from just showing up because, remember, there's still COVID that's widespread in the community. We don't want situations where people are lining up outside of a building waiting and asking to be given an appointment. We want to make sure that this is handled safely and in an organized fashion. So give us time to plan, and we're waiting on the state for more information on vaccine, and we'll be updating the community.
Thank you, Nancy. We'll catch up with you soon.
Thanks, Dan.